Hello everyone, welcome to today's webinar. My name is Michael, and in a few moments I'll be passing you over to Helen to talk about returns and medications. But firstly, there's just a little bit of housekeeping as always. This webinar is designed for people with knowledge in giving medications, and is to help you further understand the role that you have. If you do have any questions at all about the subject in the webinar today, please use the Q&A feature to ask. We will get to them at the end, just due to a little bit of a delay between you and ourselves. But for now, I'm going to pass you over to Helen to introduce herself and start the webinar.
Hi, good afternoon everyone. Thank you for joining the webinar today. For those of you that don't know me, I've worked for PrimeLife for nearly 4 years, and I'm involved in everything medication, including developing new training packages, audits and email. Previously to my joining PrimeLife, I've worked for several pharmacies, supporting care homes all over the country. I think of myself as a people person, and I hope you find this webinar a useful support tool. So today we're going to be looking at returns medication on paper mar chart, and this session has been requested by our care homes. So first of all, we need to look at the audits on a mar chart, and there are 5 audits on the chart. Medication ordered. So medication must be documented on the mar chart when it's been ordered from the surgery. A record of the prescription order or prescription must be kept for audit purposes. Medication received. So medication received for the resident must be documented on the mar chart, including the date received, the quantity and who received the medication. If stored in the CD cupboard, fridge or resident's room, this should also be documented clearly. Medication administered. So all medication administered must be recorded on the mar chart with the staff signature, quantity and time. If it's a time critical medication or paracetamol based product, it's important that we document the correct time. Medication refused, returned or destroyed. All medication that is refused, returned or destroyed or carried forward must be documented on the mar chart with the date, the time and the quantity. This should then be recorded in the returns book if appropriate. Additional information. Any additional information, e.g. why the person refused the medication, the time, if time critical medication or paracetamol based, must be recorded on the reverse of the mar chart. With paracetamol-based products, we must allow a 4-hour gap between each dose. But today we're going to be looking at return medication. So, types of returns. There are 5 types of medication returns. The first one is non-compliance, and this is where the resident does not take the medications as prescribed. They may take them at irregular intervals or spit the medication out. And this, we must remember, is one of our 6 rights. The resident always has the right to refuse the medication. Intentional non-adherence. The resident stops taking medication due to the adverse side effects or personal beliefs. So again, when we're looking at our 6 rights of administration, we have the right to refuse. So this could be the medication contains gelatin, or the medication causes them to feel sick. Unintentional non-adherence. The resident stops taking medication or fails to take at the correct intervals due to forgetfulness or not being offered. And this mostly applies to our residents that self-medicate certain medications and then their symptoms get worse. Non-preventative waste. The resident passes away and unused medications are wasted. A change of treatment means current dispensed medications are no longer required, or the medication has gone past its sell-by date or expiry date, or the medication is dropped or or spilt during administration. And again, this is common in care homes. You know, we offer a resident a medication and the medication may be dropped or spilt before we give it to the resident. It might be knocked out of our hands. Preventable waste. So this is where the resident or the care home stockpiles medication just in case. So we see this a lot in our care homes. All items from repeat prescriptions are dispensed, even if a resident no longer takes the medication. It is really important to communicate both with the pharmacy and the surgery if the medication changes or the medication is discontinued. If we don't inform both parties, then that medication will be sent to us. Original pack dispensing. This actually reduces the amount of waste, hence the guidance to move from dosset boxes to original packs. And remember that medications are not reused by a pharmacy, but they are incinerated. So we have in some of our homes the impression that if the medication's not been opened, it will be used by somebody else, and that's not true. It will be incinerated because the pharmacy doesn't know how it's been stored in the care home and if it's been stored with the correct temperature or heat. So medications to not return or reorder routinely. It's important not to reorder medication when it's not needed to avoid waste. This will include medications such as paracetamol, lorazepam, lactulose, and PRM medication should always be carried forward to the next cycle. But before we carry it forward, we must check the expiry date on the product, we must check the quantity, and we must document it on both the MAR charts. The current MAR chart that they're using should have the quantity that we're carrying over, and the MAR chart we will be using would have the quantity that's been received and the quantity that we've carried over. Nursing and residential homes dispose of their waste medications differently, and this often leads to a little bit of confusion. So residential homes or care homes without nursing. All medications should be returned to the supplying pharmacy. Whilst they're waiting to be collected, they must be stored in a tamper-proof container and in a locked cupboard. Care homes with nursing can not normally return their medication to the pharmacy. A clinical waste company should be used. These must be stored in a tamper-proof container and in a locked cupboard while waiting for collection. And insulin needles and other sharps must be disposed of in the yellow sharps bin, and there's an image of the sharps bin there. This must be dated when the first sharp goes in it, and there's an actual line on it where we shouldn't fill over that line. Returning controlled drug medication in a residential home. So controlled drugs, or CDs as they're commonly known, should be returned to the pharmacy. Remember to ensure that the controlled drug is documented in the CD register as a return. And what we need to document is the date and the time, the quantity returned, the name and address of the pharmacy that is collecting that medication from us. We need to check the balance and make sure the balance is correct. And we need a signature and a witness signature. I would also strongly recommend getting a pharmacy receipt and getting them to sign in the CD book to say they've actually collected the controlled drug medication. And just a point to remember here, Oromorph actually expires after 90 days once it's been opened. And in some of our care homes, we find Oromorph that has been opened, but obviously it's gone past its expiry date. So remember, when you're doing your date check-in, always look in the CD cupboard as well. Returning of controlled drug medication in a nursing home. So this is slightly different to a residential home. Controlled drugs must be denatured in a nursing home and disposed of in a dupe or doom kit, and these are available from your pharmacy. Tablets and capsules should be removed from the foil. Ampoules should be opened and the injections and the liquid poured into the doom kit with other liquids. It's really important that we take care when we're doing this. CD patches should be folded sticky side to sticky side, cut into pieces, and again placed in the doom kit. Controlled drugs should be denatured by a registered nurse and a suitably trained witness. So I get asked a lot, what is a suitably trained witness? So this is a member of staff who has undergone medication training or understands what it means to actually witness, okay? The controlled drugs register. So here we have an image of our new CD book. The format is simpler and easy to follow. These are now available from head office alongside a new online CD training course, which mirrors our new CD book. More details will be sent out to you shortly about receiving these books. Remember, you do not need to throw a CD book away if you make an error or if there's a change of manager. CD books should only be replaced if they are damaged and we can't read anything in it, or the book is completely full. So documenting CD returns. Controlled drugs, and as I said before, all these are sent back to the pharmacy unless you're a nursing home where the clinical waste collector, who has a special license to collect controlled drug medication waste, will come and collect the controlled drugs from you. Remember to ensure that the controlled drug is documented in the CD register as a return. And as we said before, we need the date and time, the quantity returned, the name and address of pharmacy, check the balance, get a signature and a witness signature, and get the pharmacy receipt, and if possible, get them to sign in the CD book. Remember to store the pharmacy receipt safely, because you may have to look back at this to prove of evidence of the return. Returning medication on the MAR chart. It is important to document return medication on the MAR chart to provide a clear, accurate audit trail. There is a space on the MAR chart to document return medication. Refused medication should be documented as a refusal using the correct code on the MAR chart and the reason recorded on the back. The medication should then be tagged and bagged if it is a refusal, and placed in either a returns tag and bag or labelled in a bottle that's clearly labelled refused medication. Before placing the medication in the returns, a quantity on the MAR chart should match the quantity in the returns book. And remember, if a resident has passed away, the medication needs to be stored separately and securely for 7 days before returning to the pharmacy. Recording what's been returned or refused. So it is a legal requirement to keep full records, paper or electronic, of all medication that's disposed of in a care home setting. The NICE guidelines states that the following needs to be documented. As we've said before, the name, strength and form of the medication, the date of the medication was returned, the amount being returned, the reason for return, and it's not, we need to put more description on this. So we can't just put excess stock. We need to put that the stock's been discontinued, or the resident's passed away, or the medication's been stopped. It's not acceptable to put excess stock, because that would be queried by our inspectors. And the name of the staff making the return record, and as good practice, we also record the name of the resident. So, recording what's been returned or refused. So, return medication books are available from PrimeLife Head Office Central Services. The return medication book should be a carbon copy book, and it is recommended that the pages are numbered for audit trail purposes. Remember, good practice is to use 1 page per item when returning a controlled drug. Recording what's been returned or refused. So medications for disposal should be separated from those in use and kept in a locked room. All outdated, refused and unwanted medications must be disposed of appropriately, either being returned to the pharmacist or via a doom box for safe disposal. Signed records of transfer from the service to the authorised contractor or pharmacist must be kept. And the frequency of return medication will be determined by the size of the care home, number of clients, and an agreement with the pharmacy. And if you have any queries about that, please refer to the PrimeLife Safe Handling of Medication Policies and Procedures. So sometimes residents will refuse to take their medication. It could be because the medication is hard to swallow, it tastes unpleasant, or causes side effects such as loose stools or constipation. We can usually tell from the person's reaction that they dislike the taste or that the drugs cause unpleasant side effects. We need to contact the GP for advice on alternatives. There are times when the person is more comfortable taking the medication in a particular setting or with the help of a certain member of staff. Always think about your dignity and respect training when administering medications to your residents. If the resident refuses the medication, we can offer the medication later, but this must be documented with the exact time on the MAR chart and does not apply to time-critical medications. Remember, the resident has the right to refuse. And it is important to remember to document on the reverse of the MAR chart any results or outcomes if the medication is a PRN or when required medication. As we said before, do not be tempted to try hiding food in medication. Medication that's hidden in food is called covert medication and needs to be approved and have written consent in place. This should be documented in the care plan and documented on the MAR chart. And think about your MCA and DOLS training when administering medications to your residents. Does the resident have capacity to refuse to take their medication? If they refuse, try again later, and remember to document and report all non-administered medications and inform the manager if the medication is refused throughout the day. Talk calmly to the resident, explaining the importance of taking the medication and how it will help them before documenting it as refused. Remember, documenting all non-administered medications on the MAR chart is just as important as documenting when a medication is given. This information could be really important later. Always remember to wash your hands before and after administering any medications and use the appropriate PPE. Remember to clean the medication trolley before and after each medication round, replenishing the medipots, giving spoon and syringes. Also remember the rule about bare below the elbow. Think about your infection control training when administering your medications to the residents. So, additional information. The returns book. Check that you have a returns book in your home or on your unit, and it should be a carbon copy book. The pharmacy should always have a copy of the returns, and we should have one as well for our records. Controlled drug returns. It's 1 page per item for a clear audit. Ensure this is signed by the pharmacy. Reordering. Remember, do not reorder when required medications routinely. This will lead to waste. The medication expiry date. Remember, some medications have a short shelf life and will expire after 28 days or 90 days of opening. It's always good practice to have the date of opening. Topical creams. Remember, most creams will last until their expiry date. So check the label and always add the date of opening. We don't return creams and everything routinely every month anymore. Stockpiling. Remember that we should not be stockpiling medication. Medication includes dressing, food supplements, and should only be used for the resident it has been prescribed for. Audit trails. We need to keep a record of all medication that has been returned. You may be asked to prove documentation of your returns during the next inspection. Discharge residents. Remember to keep your medications for 7 days after a resident's death. These need to be kept safely and securely and away from any other medications. Medication side effects. All the medications we've discussed today have side effects, including headache, constipation, diarrhea, rashes and sores. If you need to find out more about a medication, check the patient information leaflet in the medication box, or if you have a BNF book, or you can look on the EMC website online for all side effects, dosage information, and overall advice. Remember to monitor the resident for any changes or reactions that may be caused by the medication, and report your concerns to your manager. Always inform the supplying doctor or pharmacist if the resident is taking any other medications, including herbal medications, vitamins or supplements, cold and flu preparations. And remember, if the resident has any allergies, this must be documented on the MAR chart. Okay, so that's the session complete. Does anybody have any questions?
Well, thank you very much, Helen. I think that was very informative. We've got a couple of questions here. The first one, if I have an empty box or bottle, do I need to send that back to the pharmacy?
No, don't send that back to the pharmacy. What you need to do is remove the data from it. So peel off the pharmacy label and throw that away. You can either sticky side, throw it away in your confidential waste, and then the bottles and boxes can just go in your recyclable waste. But what it is important to do is to remove the labels, because that's got patient and resident information on there.
Okay, so data protect them.
Yes.
Next question. My medication came in a blister packs. Do I need to return the whole blister in the returns?
No, ideally, again, what you would do is pop the medication out of the blister pack. This reduces the amount of waste that we're actually sending back. So pop the tablets out of the blister pack into your returns box, and then again you can peel off the label and return and put the foils in your recycling, put the labels in your confidential waste. Perfect. It will just cut down on the amount of bulk that we are returning back to the pharmacy.
Okay, yeah, that makes sense. Last question for the moment is, how often should my pharmacy be collecting my returns?
Okay, so we get asked this quite a lot. It would depend on the agreement that we have with the pharmacy. Ideally, this should be sorry.
That's not me, carry on.
Oh, sorry. Ideally, this should be every month. So you should have it like you have a dedicated delivery day, you should have a dedicated returns day. So the pharmacy will come and collect those returns away from the care home. It's important that we don't have returns stocking up month after month. But I would actually speak and communicate with your pharmacy and ask for a definite date. What we need to ensure, though, is that we've actually got all the documentation and all the returns ready for them to collect. So definite date, agree that with your local pharmacy.
That's fine.
Simple case of, if they're not making that date, give them a call, find out what's going on, and get them to come as soon as possible.
Absolutely, because what we don't have, it proves a risk that if we've got medication that we need to return, we need to get that out of the care home as quickly as possible and as safely as possible. So agree that at a local level with your supplying pharmacy.
Perfect. Okay. And there doesn't seem to be any more coming through. So thank you very much, everyone, for those questions today. That brings us to the end of the webinar. Thank you all very much for watching. Helen, if they do have any more questions or want to get a hold of you, how can they do that?
Yeah, not a problem. Just call me on 0791 704 5483, or you can email me at helenberridge@prime-life.co.uk.
Brilliant, thank you. Just so everybody knows, we're not here in 2 weeks' time now due to other commitments. So our next webinar will be on the 4th of August. And I think that's for covert medications, because we've had that come up a few times now. So we'll see you then. Thank you very much for watching.
Okay, thank you, everybody. Bye.